Deaths from beating can sometimes result during the custodial period when the person is being subjected to the interrogation torture that the police officers basically perform during the interrogation sessions that are being carried out by the normal routine police investigations from the prisoners of the custodies. But these tortures should be of a minimal level, and the human right violations should not occur during these torture periods or during these interrogation periods. A lot of methods have been devised by the interrogation cells or the torture cells, and they sometimes are quite inhumane. But repeated visits to these torture cells have been carried out by the forensic experts just to have an overview of the torture cell, of the environment of the torture cell, and just to get an idea what kind of tortures have been subjected to the prisoners by the police officers. And they should not be of any inhumane process, because a lot of electrical tortures are there, and sometimes the prisoners are burned just to get the information from them during the interrogation periods. So these methods sometimes include the beating process, and we'll basically discuss the beating process over here. That is being performed during the interrogations by the police officers. What kind of the beating processes are over there and how are they carried out? We'll just have a look to that. Now, the deaths from the beating, the reasons for the death are discussed over here, and then there are features of injuries, and features of injuries are discussed in detail over here, because they are going to point out towards the fact what kind of weapon is being used to perform that injuries. It can be a blunt weapon and it can be a sharp weapon. So we'll basically inculcate these factors over here, and then we have another factor which is known as a falanga. Falanga is basically a type of a posture that is being made by the police officers, and the victims are subjected to severe torture. It's a quite painful procedure, and the investigation during this procedure is being carried out through this posture, and it's quite painful, and it's being banned by a lot of countries during the interrogations or during the torture cells. So we have to keep that in our mind as well. Now, the beating. One has to be quite particular during this beating process. Now, most common forms of torture are over there, and it can basically include the blunt weapon injuries, and it can also include the sharp weapon injuries, wearing upon and wearing both with the weapon used, or the body parts are injured in such cases. And it's quite painful for the person who is being subjected to such kind of a beating process. Now, blows both to the head and the other parts of the body are also a part and parcel of this procedure, and it can be a head injury. And head injuries also include basically the coup and the contact coup injuries, and it can be the on the external surfaces, and obviously on the internal surfaces, and on the other parts of the body as well. So we'll basically just have a complete examination of the live person, or even if you're performing an autopsy, and we are basically calculating what kind of a beating process the person has been subjected to. We'll just basically enumerate whether they are the blunt injuries or whether they are the sharp weapon injuries, and we will basically deal it just like any other homicide that has been carried out. And we're writing down the autopsy report accordingly, how these injuries have occurred, what is the time since injuries. Obviously it's not immaculate. The time since injuries is just calculated on a rough basis, so it's also being carried out in that way. Now, the reasons for death, not often sole cause of death, and the deaths can occur from the hemorrhages, of course, and the sepsis is also one of the reasons of the deaths. Now, the hemorrhages are again very important over here. Obviously, if it's a blunt injury, apparently we won't have that much of damage, and if it's a sharp weapon injury, severe hemorrhages occur after these sharp weapon injuries. Whether it is a single-edged weapon or whether it is a double-edged weapon, hemorrhages will occur. There'll be blood loss, and the person is going to go into shock. So all of the treatment of the shocks are going to be there, And if the death has ensued, we are just going to write down that the cause of death was the hemorrhage that resulted due to the fatal injuries that the person has been subjected to. Then we have sepsis on the other hand. So some injuries can be quite infectious to the person, and in that case, if this is the case, then infections can result, and it can be of a very severe type in that case also. Then we have an injured internal organs. So in a lot of cases, we can have internal organs that have been damaged. So that can also be a cause in a lot of cases. Then we have sheer exhaustion and pain. So one of the basically you can just have a look at all of the causes of the deaths that can occur. The underlying causes are quite evident. These are basically any causes, basically any homicidal causes during any routine homicide. So the police interrogations can sometimes be so painful, and they can be sometimes so harsh for the person who has been subjected to these kind of interrogations, that all of these hemorrhages, whether it is an infectious condition or whether it is an injury to the internal organs or the sheer exhaustion and the pain, all of these can basically cause a complete nervous shutdown, or it can result in a circulatory shock and a nervous shock, or it can result in all of these conditions can basically combine to the cause of death of the person. So it's not a single cause, and sometimes all of these contributing factors are present over there, even in a single case. Now, the features of injuries in such a case are: it can be blows inflicted by fists or foot. It can be often applied with a weapon. Single or double-edged sharp weapons are sometimes used, and confluent petechial hemorrhages are sometimes used over there. The mark of the red patches are sometimes present over there in these features when we are featuring these injuries. Whatever the kind of the physical appearance of the bruise or the physical appearance of the sharp weapon injury is, you just have to write it down completely, detailing the size, the shape, and the location of the injury as well. Now, the tram-line bruises are basically the bruises that are going to tail down. It's basically a single complete bruise, and it's tailing down. That is known as basically the tram line bruise. And then we have it can be an intradermal bruise. Abrasions or lacerations are sometimes also present over there, and we have the scarred healing procedure, also a part of these features of the injuries. Now, the repeated beating and the multiple marks are also present over there in a lot of cases, and focal damage by the metal tags is also a part of these features of the injuries that are being carried out over here. So, as I was already mentioning, there is a posture that is known as falanga and is being carried out in a lot of countries. It's obviously illegal, it's banned, and it's inhumane because it is quite painful and it is quite debilitating. This picture is basically demonstrating the posture of the person, and the person is put in this posture. It's basically a quite hypotensive kind of a condition, and as well as it is quite difficult to breathe in such kind of a posture. It's a positional asphyxia kind of a condition, and the person is beaten along while performing the interrogation. So it doesn't reveal the bruising, so it is quite helpful for the person who is carrying out such a torture cell. And its aseptic necrosis may occur after this condition. Bruises on deep dissections in the victim. So there will be a blunt injury. Apparently the person will not have any bruises, but there will be deep bruises on the victim after carrying out the autopsy. If injuries are a month old before examination, no evidence unless the skin is broken. So if the skin is broken, that will be the only evidence. We won't have any external bruises in such a torture. Faint red lines are present in a lot of cases, and in pale skinned people it's quite evident. And racial melanin pigment. So it's hyperpigmentation at the injury line. So if it's a pigmented person, in white persons, we'll have a red line. In more fair-skinned people. And in people with a dark skin tone, we'll have the hyperpigmentation at the injury lines present over there. And the depigmentation in some scarred tissues is also present, and the evidence that the person has been subjected to torture. So a forensic practitioner should know about these kind of tortures as well, in which evidence is not quite present at the naked eye examination level. So autopsy is being performed in such cases, and that is basically the evidence to the torture in such cases. So in this section, basically, we dealt with how beating is also one of the part of the interrogations that is being carried out at the torture cells, and how can we basically investigate and get evidence for this kind of tortures. That is the end of this section. Thank you for watching sqadia.com.